We're here today with Dr. Anne Scheetz.
So my work is to pass and implement in the United States a single-payer universal health care system, under which we would not have to discuss something like Medicaid estate recovery. So what happens is that if you're on Medicaid, under certain circumstances, the government, ultimately the federal government, but sometimes the states also, can recover some of what they've spent on your health care, and they can take that from your estate after you die. So there are some limitations on it, and some people will tell us that those limitations are excellent protection. For instance, you can't impoverish a spouse. You can't recover from an estate if there's a child living of any age who has a disability, certain disabilities at any rate. You can't recover from an estate if there's still a child under the age of 21. So they tell us that this is adequate protection, but of course we all know that that's not the case. And this has become more of a problem under the Affordable Care Act. It's become a more prominent problem because it used to be that people did not get on Medicaid if they still had assets unless they went into a nursing home. Now, or in certain circumstances if they got home services. And now there are more people getting onto Medicaid who have assets, such as owning a home. So when those people die, the money that has been spent on their health care could be recovered from their estate. So this is actually, you have to be poor to get on Medicaid. So this is actually a death tax on the poor, instead of this death tax on the rich that we've heard that is such, people have so many objections to. We have a death tax on the poor. What we would do instead is say, everybody's on Medicare from birth to death. It's funded entirely by taxes, and those are a progressive tax. So the less you have, the less you pay. The more you have, the more you pay. You have prepaid for all of your health care. You get whatever you need. There's no question of having to consult a lawyer to protect your assets after you die.
And so now, under the Affordable Care Act, with the new expanded coverage, so basically people who wouldn't have been eligible before, right, now they could be responsible. Once if they die, their estate is responsible. So do these people, are they told this before they go onto Medicaid, or is this something that could be a shock at the end of their life?
Right, many people don't understand this. Many people are not being told this. It's one of the many complexities of the Affordable Care Act that people don't understand until it hits them. It's also true that even before, many people did not understand that if they went into a nursing home, they were at risk of losing their home. Or if they understood that, then they did everything possible to avoid getting health care that they needed in order to protect that, because people really do want to leave something for their children and their grandchildren.
And so that's why single payer would be the solution.
Absolutely.
In your view, and then also the view of the organization you work with. And what is the organization you work with again, or volunteer with?
Right. I work with the Illinois Single Payer Coalition and also with the Illinois chapter of Physicians for a National Health Program. And both of those are organizations that work for a single payer healthcare program, which we also call National Health Insurance or Expanded and Improved Medicare for All.
Okay. And so, Anne, what do you, until we get a single payer in the country, what do you recommend people do if they believe they could be at risk at some point? You know, they pass on and their estate could be taxed. Do you have any recommendations?
Well, if you can afford it, you can certainly consult a lawyer. But no, the healthcare system that we have now is unfair. It's unfair to people on Medicaid. It's unfair to people who have to buy private insurance. It's unfair to people who have employer-sponsored insurance. All of us are being harmed by the healthcare system that we have now. The healthcare system that we have now penalizes people who are sick, people who have disabilities, anybody who needs healthcare. And that's what we want to get rid of. So it's to the benefit of every one of us to work for a truly just system. It also happens that a truly just system is less expensive because it's more efficient to just give people care than to set up mechanisms to see who should get it and who shouldn't.
Right. Well, very well spoken. And there's another issue you wanted to talk about, which is denial of transplant services. And I'll let you explain it, but there's been some controversy, and supposedly there has been the denial of a couple transplants. So would you like to tell us more about that?
This is another area that's extremely complex. So, as you probably know, undocumented immigrants have very limited access to health care. They can get emergency care, but of course we don't want people to need emergency care. There are some cases that are inevitable. They're always emergencies, but what we want is for people to be taken care of before something gets to an emergency stage. So when people have kidney failure in its advanced stages, dialysis becomes an emergency. If you don't get dialysis, you'll die. So the federal government does not pay for health care for undocumented immigrants, so some states have instituted payment for dialysis as an emergency, and they do it on an ongoing basis so that it doesn't actually become life-threatening, the risk of kidney failure. Now, people who are on dialysis do much better, live longer, have better lives if they get kidney transplants. And Illinois decided in 2014, after a great deal of work on the part of advocates that included hunger strikes, a lot of advocacy working together among community activists, physicians, and legislators to fund kidney transplants for undocumented immigrants. And there are certain transplant centers in the state, in Chicago in particular, that we're doing those. So a kidney transplant is not a trivial undertaking. Not only do you have to put in the kidney, you have to make sure that forever after, for the rest of that person's life, they get anti-rejection medicine. Otherwise, the kidney transplant fails. So the state of Illinois decided to fund this. Now, Governor Rauner has proposed that the state should stop funding both transplants and dialysis for undocumented immigrants. And it appears that in response to that, and the university has not put out a statement, but it appears that in response to that, they have denied transplants to a couple of people who are waiting for them. And there has therefore been a demonstration this past week on the part of activists who are demanding that they go back to providing the transplants. Again, this is something that under the single-payer program that we work for, this would not even come up. If you live in this country, you would have insurance coverage for everything. And that would include transplants and dialysis and anti-rejection medicine, as well as everything else that you need, all under one program. Very simple.
Wow, so with this possible denial of a transplant, they're anticipating what the Rauner administration might do. Could the Rauner administration, could they also deny the anti-rejection drug too?
Yes. The state is not required, the state decided to fund those things, but there's nothing superior to the state that can force the Illinois to fund any kind of health care except for emergencies, life-threatening emergencies. There's no requirement for the state to provide funding for any kind of health care for undocumented people. And especially, it's not the case that immigrants are taking from this country more than they give. They give more than they take. That's even true in Medicare and Social Security, that some people get illegal Social Security cards. They pay in. If you're working with the Social Security card, you're paying into Social Security and Medicare. When the time comes for you to collect on those, you probably won't be able to do it. So you're actually putting in and not being able to get out. And we say that that's wrong. And of course they pay taxes. Nobody has found out a way to not pay taxes except the very rich.
Yeah, it doesn't seem, well, obviously it's not fair, and it's definitely a crazy system. And hopefully the Rauner administration, they won't do this, because it's not smart. It's definitely not smart health practice, and it's not smart, to be providing services on an emergency basis. That usually costs way more money than it would be if they did the transplant. So, do you have any final words about?
Yeah. So this is Rauner's proposal, but of course it's not up to him. The legislature makes laws in the state of Illinois, and so all of us should be talking to them about this, about the need to fully fund health care, but also a longer-term vision of a single-payer system for the whole country. The other thing, even now, Illinois does not continue to pay for anti-rejection drugs if the person moves out of state. Well, this is not the way we want to live. We want everybody in this country to be taken care of. regardless of where they live. So a just healthcare system is also the most efficient and least expensive healthcare system. That's what we'll all continue to fight for. We'll fight for that at the state level and also at the federal level.
Well, great. Thank you so much, Anne, for joining us. And I hope you have enjoyed this little bit of information and that you'll contact your legislators to talk with them about these important issues and other things too. So thank you so much.
This is LaDonna Friedheim for Adaptive Chicago Productions. I'm here with Dr. Anne Scheetz. Hello.
Hello. It's good to be with you.
Can you tell us a little bit about the Trans-Pacific Partnership?
Right. It's a trade deal. The Trans-Pacific Partnership is a trade deal that's being negotiated among multiple countries that border on the Pacific. And our concerns about it are a couple. One is that it's being negotiated in secret, so that everything we know about it is actually from leaks. We don't have the details of the proposed treaty have not been released to the public. They're not even released to the people who will be voting on them in the U.S. Congress. And the other thing that we're concerned about is that from the leaks, we know that it's a strongly pro-corporate trade deal that's being negotiated, which means that it gives precedence to corporate profits over what people need. And we believe that the opposite should be true, that people's needs should take precedence over corporate profits.
And how could that affect us?
To some extent, we don't know for sure because it has been negotiated in secret. So there's no opportunity for us to read it, analyze it, debate what would happen with the provisions. We know from some previous treaties that have been negotiated that, for instance, tobacco companies have sued governments over their efforts to decrease smoking because it interferes with the profits from tobacco. Of course, that makes no sense to us, but it makes sense to the corporations that sell tobacco. We're concerned that the price of drugs would increase, for instance, because now in the United States, the price of drugs is already astronomical. There are many important drugs that people can't afford. This would make that worse by extending patent protections so that, and interfere with government's ability even to negotiate drug prices, which is one of the things that we need to have happen. We're concerned about the cost, for instance, of water and utilities, because again, in some other countries, those essentials of life have been privatized, and corporations have insisted that they should be able to make as much profit as they want, no matter whether some people are denied water or access to electricity or gas, that their corporate profits take precedence over that. So we need to have all of this out in the open so that people know what's being voted on, and that's not the case right now.
So this could impact our health.
It could impact our health, absolutely. The other things we're concerned about are, for instance, air quality and water quality, because if corporations want their profits at the expense of dumping pollutants into the air and water, how are we going to be able to protect ourselves from that? These corporations can actually sue national and local governments in courts that are dominated by lawyers for the corporations.
That sounds unfair.
It's very unfair. We're asking, this is a moving target in the U.S. Congress right now. So there have been votes called, votes postponed. So what we're just asking people to do is to call their U.S. senators in Illinois, that's Senator Mark Kirk and Senator Dick Durbin, and tell them no fast track. So fast track is a way of preserving the secrecy around these agreements. That's the first thing we have to get rid of. If the proposed agreements are brought out in public where we can all talk about them, then people will see what's going on and we can instruct our senators and representatives how to vote. So the first thing is no fast track. This has to be out in public. It has to be released to the public. There need to be public hearings at which ordinary people can say what we think about this. So again, we're asking people, tell that to Senator Mark Kirk and Senator Dick Durbin, no fast track on trade deals.
Is there anything else we need to know about this movement?
There's a lot more that we need to know, but much of it is being kept secret. And that's the first thing to work on, is to get this out in the public realm.
So no fast track.
No fast track.
And we can all help by contacting Senator
Dick Durbin and Senator Mark Kirk and telling them no fast track.
Thank you very much.
Thank you. Hello, I'm Dr. Anne Scheetz, and I am deeply concerned about an issue currently under consideration in the U.S. Senate, so-called fast-track authority for a series of foreign trade deals, including one called the Trans-Pacific Partnership. Fast track allows trade deals to be negotiated in secret, with the Senate finally voting yes or no on the whole package with very little debate. Under fast track, there is no public examination of the contents of these treaties, no opportunity for us to understand how they will affect our lives, no opportunity for us to debate them and influence our public officials. Because no details of the proposed Trans-Pacific Partnership have been released, what we know comes only from leaks. Those leaks have caused great concern to nurses, physicians, and public health professionals. National Nurses United, Doctors Without Borders, Physicians for a National Health Program, Physicians for Social Responsibility, and members of the American Public Health Association are among the practitioners who have warned that these deals will have a negative impact on health in the United States and in developing countries. For example, the deals would increase patent protections for drugs, allowing even greater escalations in the cost of essential medicines than we are seeing now. Health insurance companies would gain greater protections for their profits at the expense of people's access to health care. Tobacco companies could sue governments over programs to discourage smoking. What about the effects on the cost of durable medical equipment, utilities, transportation, and water, necessities of life that already strain the budgets of people with disabilities and other ordinary people? We don't know because the contents of the deals are secret and no analysis has been published. What does this mean for people with disabilities? People with disabilities need medicines, equipment, and services. Most of all, people with disabilities depend for their lives on a just distribution of society's goods. These deals, if enacted, would give corporate profit even greater precedence over people's needs than is the case now. Disability rights activists say, nothing about us without us. We understand the dangers of allowing laws that affect our lives to be enacted without our input. If Congress approves fast-track authority, the secrets surrounding the Trans-Pacific Partnership and other trade deals will continue. Please call Senator Dick Durbin and Senator Mark Kirk today and tell them no to fast-track. Tell them the contents of these trade deals should be released to the public for examination and analysis. Tell them there should be public hearings at which the people can be heard.